All right, let's speak more about this now. Bring in the country director for UNAIDS South Africa, that's Eva Kiwango, who joins us via our video link. It's lovely to have you on the SABC News channel, ma'am. Thanks very much indeed for your time. I wonder if we can just start by reflecting on the remarks made by the Health Minister, Dr. Aaron Motsoaledi, referring to this particular report as a wake-up call. To what extent do you agree with that?
Thank you very much, and good morning to you and your viewers. Yes, absolutely. The report shows that the data that we collected in 2024, just before the sudden collapse and announcements in terms of withdrawal funding, that we have made remarkable progress. I think we need to start there. For decades, communities, governments, development partners have put in a lot of hard work and innovation that has led to significant declines. You heard there about 40% decline in AIDS deaths since 2010. We've seen, 40% decline in new infections since 2010, 54% decline in AIDS deaths since 2010. And we have saved 4.4 million children, protected them from acquiring HIV. So significant progress, as Mawini was saying, one of the most successful public health responses in history. Now, the disruptions that have happened, we are definitely worried about losing all these gains that we have made. And modeling does show, as was covered in your piece, that we could potentially see an increase in new infections in the next 4 years up to 2029 by 6.6 million, an increase in AIDS deaths. So we are concerned about all of that. HIV prevention, even before these cuts, we were still struggling, and we were still at, lots of new infections happening per year. And in the report, 1.3 million new infections happened in 2024, and this has not changed since 2023. So concerns still exist, and we are very worried that with the sudden withdrawal, especially from the single biggest HIV donor, which is the US, combined with cuts from other governments, governments are now moving, other donors are moving towards funding defense budgets. And so that is putting all our progress at risk. So yes, I understand where the Minister of Health is coming from, but as Mawini has also said, there are governments in the South are standing up. Communities are acting resilient. They're standing up and changing things around to make sure that we adapt and transform quickly.
Yeah, I was going to raise this later on, but since you've touched on it, we might as well get there. I wonder how much of what you reckon is going on actually has to do with the power imbalances between the global north and the global south, especially when you consider who carries the burden really of HIV and AIDS if this funding is pulled out the way it has.
So you talk about the imbalance between the global north and the global south. There are several issues that, HIV cannot be considered in isolation. As part of SD, the Sustainable Development Goal 3, we'd like to reiterate that it's connected to other things, other Sustainable Development Goals, including poverty, including education, gender, and other things, and other SDGs. But like I said, the Global South governments are rising to the challenge. In South Africa, the Treasury has committed to relook at its budget, and as you heard from the Minister of Health's speech in Parliament, budget speech to the Parliamentary Committee on Health, they have reallocated funding to cover some of the gaps, that have been left by the withdrawal of some of the PEP funding, especially USAID funding. So reallocations are happening. We're not sitting down and waiting for these governments in the north to come back and, save us. We have to, governments in the south have to take ownership of their responses, and they're already doing that. The report shows 25 of the 60 low and middle income countries have included, have increased domestic budgets, and I know South Africa is one of them. The other thing that we have to do is we have to find efficiencies. We have to make sure that every dollar that we have, South Africa funds 75% of its response. That's millions or millions of rand. We have to make sure that every rand is being used effectively and efficiently. We have to make sure that the money we still receive from the Global Fund is being used efficiently, and there are several ways of doing that, including integration of HIV responses into the public health system where possible. Concerns remain around adolescent girls and young women, programs that were funded by PEPFAR, as well as programs for key populations, which were mostly heavily reliant on PEPFAR funding. So we do need to make sure that domestic resources now, we put more domestic resources into programs for adolescent girls and young women, as well as programs for key populations.
Right. A lot, of course, being said about the funding crisis, and don't get me wrong, that certainly has its place. But I wonder if you and I can also speak about some of the challenges within countries in the global south, including some of the regulatory hurdles that still exist, the criminalization of sex work, the criminalization of LGBTI relations. I know there's also real concerns about just people, for example, who inject drugs and them not being able to get the kind of access to healthcare that they need. Surely those are also hurdles that we certainly don't need if we're going to get to where we want to in the next couple of years.
Yes, absolutely. And you heard from our executive director, Mawini, that the report is showing for the first time that they were facing backlash against the rights, laws, and policies in wider society to end AIDS. And for the first time, we're seeing that the number of countries that are criminalizing key populations, like men who have sex with men, sex workers, people who use drugs, has increased. Fortunately for us in South Africa, we have quite an enabling environment. But we still need to work on policies, like the policies that discriminate against sex workers. There was some advancement in that in 2023, 2024. And I think, the seventh government has to revisit that issue and make sure that we decriminalize sex work. These structural barriers, including gender inequalities, as you've mentioned, persist, and they heighten the vulnerability to HIV, particularly for girls and women, but also for key populations like sex workers and men who have sex with men and people who use drugs. And it prevents them from accessing services. And this, in its when we look at the prevention response that we have put together, the National Strategic Plan for HIV, TB, and sexually transmitted infections in South Africa, they have highlighted the need to address these structural barriers. And we do now, I want to mention this before you take me off air, we do now have some incredible tools in our prevention toolkit that are going to help us to revolutionize our HIV prevention response, including for adolescent girls and young women, and in turn reduce new infections and potentially bring us towards epidemic control. The report mentions that if South Africa was to put 1.8 million people on this new drug called lenacapavir, which we're calling a miracle drug, we would see a reduction in new infections by 25%. But we need to come together as communities, as government, to really push the monopolies to drive down the cost of this new technology. It's right now, 2 injections per year going for $28,000 a year, and we can't afford that in the South. Low and middle income countries, including South Africa, cannot afford that. So we need to work together to really advocate and push pharmaceutical companies, including Gilead, to bring down the prices of these new technologies.
Yeah, it's absolutely not a new discussion in health. I mean, so much of what you're saying was mentioned at the height of the COVID-19 pandemic, how access to this life-saving treatment is not just about, saving a particular country, because we all have skin in the game to put it mildly. Thanks very much indeed for speaking to us. Really do appreciate the time. That's Eva Kiwango, who is the Country Director for UNAIDS South Africa.